They need to understand that healthcare is more than just medicine.
Beautiful tips. Thank you very much.
Thank you.
All right. The 4 spiritual secrets that can save your life comes from Nurse Jennifer Shakin. She's a pediatric critical care nurse at Georgetown University Medical Center. She's been a nurse for 16 years. So Jennifer, what is your secret?
My secret, Dr. Oz, is that there are both good times and bad times to speak to nurses.
Can you give us some details?
Absolutely. The first bad time would be 7 a.m. The reason for that is that 7 a.m. coincides with change of shift in the hospital system.
Right.
And when one nurse is coming on shift and the other one is going off shift, if that is actually interrupted, then that can break down communication. And when they're reporting off to each other about your care or your family member's care, a vital piece of information could actually be missed.
Excellent. So 7 a.m., leave them alone. Could be like little chatterbox in there without talking to each other. That's a good thing. We're talking about you. The next dangerous time, the bad time to speak to a nurse.
The next bad time to speak to a nurse is actually 10 a.m. And the reason why that is that in acute care settings, 10 a.m. is a standard time of medication delivery. And it's just like the safety issue with communication, the safety issue regarding medication is very vital to clearly patient safety. And actually in hospital systems now, there are no interruption zones. But that is in order to prevent any type of medication error.
Which happen a lot, and only we can prevent them by paying attention in those critical times. Okay,
absolutely.
Now there is a good time to talk to a nurse. In fact, there's 2 of them. What's that?
Yes. So the good time, relatively speaking, is 3 p.m. in the afternoon. We'll also say 3 a.m. in the morning, which I don't know who's awake then. But, yeah. Considering that in the 24/7 time that nurses are actually at the bedside taking care of patients, 3 p.m. is a good downtime-ish time to kind of speak to the nurse, even if it's either you or your family member, to be able to just kind of get the plan for the next 24 hours, because that nurse, he or she definitely knows that plan at that point.
In fact, families are often coming to the hospital at this hour anyway, so it's not a bad time to keep up. Thank you very, very much.
Thank you.
Okay, and now the 6th nurse's secret that can save your life comes from Nurse Paula Jean Greer. Paula is a certified nurse midwife from Harbor Hospital in Baltimore, Maryland. She's been a nurse there for, listen to this carefully, 37 years. She's got a lot of secrets. What's the one you want to share with us today?
Dr. Oz, my secret is you have to ask us. And I mean you have to ask us. Because we do have secrets on how to make your tests and your injections less painful.
So can you give me some examples?
Absolutely. For example, I'm going to draw your blood.
We got a couple of tape coming over here.
For those of you who are allowed to have something to drink, and you know you're going to have your blood drawn, make sure you load up with at least 3 glasses of water so we can find your veins.
Yeah.
Absolutely don't come dehydrated.
Yeah. Any of you who whine about small veins, this is your solution right here. Anyone has the opportunity to do this. Okay, so water for that. And you have a numbing cream?
Some people who need their blood drawn or they need IVs started, big injections, little do they know that if you asked us, we could provide some numbing by putting some cream on and making it much less painful.
Yeah. How many of you knew that? Put your hands up. Of the non-nurses here.
Yeah, not but you gotta ask.
Gotta ask.
Gotta ask.
Gotta communicate. And finally, for intestinal exams. I wish I had known about this, but go ahead.
When you did your colonoscopy. Yes. Well, and I tell my pregnant patients that they have to do the sugar test, for example. Drinking that very sweet drink is not pleasant, but the colder anything you have to drink for your stomach test, for your sugar test, get it as cold as humanly possible. And it goes down much quicker and much easier. It's done.
And again, all of these, whether it's colonoscopy, intestinal tests, the sugar test, freezing these things down makes a ton of sense. It doesn't hurt the efficacy of the test at all. It works just as well. So ask the nurse and learn the secret. Did I get it right?
You got it right.
They're always being graded by nurses. It's good stuff. All right, coming up next, the nurses share healing secrets from the hospital that you can do at home. Stay with us.
Coming up,
We have a healing secret for wounds.
and it's probably in your fridge.
You can eat what's left over. It's wonderful.
Then,
I've been waiting for this one all day long.
the hangover cure you'd never expect. Nurses' healing secrets you can do at home.
Right there.
Try that and see how that works.
Next. Tomorrow, a Dr. Oz medical alert. Is your fat causing cancer? New life-saving information.
It increased the chance 57%. It's scary. It's right. Every cancer I talk about today is linked to obesity closely.
If you're waiting for a reason to finally lose weight, this is it.
It turns on the cancer cell's ability to grow faster and faster. Can you all see that?
The revolutionary research you need to hear now. That's coming up tomorrow. Fox Monday.
We can
fight each other. Who can fight them?
Become
Take the shot.
allies. Only Terranova. Then, does a patient's secret bunker mean he's paranoid?
Not in that case.
Or is it a symptom of a deadly disease?
Cool.
Whole new house. It all starts tonight at 8 on Fox 5. Get more with the ultimate triple play from Optimum. Visit Optimum.com for details.
2 sofas, regardless of size, only $7.98 for both pieces.
Holy mackerel, bonded leather everywhere you sit.
My Bob's is different. Choose any size sofa.